Right, so how many of you still have an NHS dentist, I wonder? Any of you? Well, how do you fancy that being the future for seeing a doctor or a GP? Well, it just got passed into law and you probably didn't hear a damn thing about it. Oh, and if you're hoping a future Labour government will reverse this change, then forget it, because Sir Abstains-a-lot Keir Starmer had his party sit on their hands once again and let this pass. We know there's a chronic shortage of doctors and other health professionals. We know it takes years to train them, and yet the Tories have said they can pretty much magic them up and solve the problem. But their solving the problem is to inflict medically untrained people into the role doctors were doing. And this is so incredibly dangerous, for such obvious reasons, that the fact it is going barely reported at all is a travesty. But considering the solutions all involve someone making money as well, this should be seen for what it is, and called for what it is. The role of the doctor is being scrapped to suit big business, and certainly not to provide us with an operational NHS that's actually staffed by medically trained professionals. Right, so what's happened here then, Damo? Well, what we have here is the exposure of the Tories' master plan to solve the doctors' crisis while still selling the NHS off to vested interests by creating new roles for medically untrained people. But they're going to make you think they're doctors, even though they aren't. What the Tories have just done is give oversight to their newly created roles of PAs and AAs, nothing to do with personal assistants or Alcoholics Anonymous. They are actually competent and useful. But in this case, the abbreviations stand for Physician's Associate and Anaesthetist Associate. You can basically think of them as fake doctors and fake anaesthetists. So would you want to see one of those if you were admitted to hospital? There are also nursing associates out there too. The word associate will soon become synonymous with not trained. These roles are already in existence, have been for a little while now, not that long. But to make you think they are legitimate, oversight for them via backdoor legislation has been foisted onto the General Medical Council, the GMC, as far as their registration goes. The GMC is there for fully trained doctors only, supposedly, not for non-medical staff. But by legislating otherwise, the Tories are pulling a fast one. The roles have only recently come into existence. This latest move is more about fooling the general public into thinking they'll be seeing someone medically trained when they aren't. But already there have been at least two deaths, linked to PAs, one where an embolism got mistakenly diagnosed as a calf strain, and another where a serious heart condition got put down to being a panic attack. There will be more deaths to follow, and this is intentional. It's unavoidable as well, because when we need more doctors, when we know there is a shortage, when many are retiring, the training still isn't happening. And also the training can't be rushed either. In the case of GPs, 6,000 properly medically trained doctors were held back from taking such roles so that PAs could fill them instead, who are cheaper. Above all else, they're going to be cheaper. They are part of the government, or what the government's calling their long-term workforce plan, which, to nobody's surprise whatsoever, Labour's weasel of a health secretary and Starmer's sidekick Wes Streeting is also in favour, and Labour would no doubt therefore retain. Together with a smaller, separate surgical role, they form what are called Medical Allied Professionals, or MAPs. Frankly, they can call them whatever they like. If they aren't calling them a doctor, then they aren't a doctor. Where a doctor will go through 5 to 6 years of training, these MAPs, these PAs and AAs, go through 2 years of training. Where they go through a period of 12 to 24 months with a high level of supervision from a doctor. After that, they become largely autonomous, with the caveat they are still overseen by a senior doctor. More work, therefore, for what few doctors there are left, for the doctors you would think. The reality is, more likely, just wouldn't happen because they wouldn't be able to make time for that. The registration with the GMC is something of a fudge too. As I said before, by registering with them, it gives the impression that these are medically trained, qualified and competent doctors, when they're not doctors at all. A first-year doctor cannot, for example, register with the GMC because they still aren't trained highly enough. But allowing MAPs to be registered and therefore regulated, in name only or in practice, remains to be seen. But it gives the impression they are medically trained when they are not to the level required, not even close. As a result of not being regulated at all, they become involved in some utterly unsuitable procedures up until now as well. An example given by Doctors Association co-chair Dr. Matt Neal, he spoke of PAs being involved in neurosurgery, brain surgery, with some PAs having said they are learning about anatomy on the job. It's not a building site. These are lives, people's lives. Doctors go through the years and years of training they do because theirs is one of the toughest and most complex professions there is. You don't learn as you go. You don't learn by trial and error. Not when it comes to the difference between life and death as they deal with every day. So where does big business come into this then, Damo? Well, I'm sure you've all heard of NHS England by now, haven't you? How many of you think it's the NHS in England? That it is literally the NHS? Well, if you do think that, then I've got news for you, because actually NHS England is not the NHS at all, but a government quango. A body that the government has just devolved powers to, and in 2014, going back 10 years here, the former Vice President of United Health, a US private healthcare and health insurance company, everything we don't want involved in our NHS, isn't it, took over NHS England. Now, this was a guy who had been a health advisor to Tony Blair previously. All the cuts and the health reforms that New Labour oversaw, that government oversaw, that was just the start. By ending up in charge of NHS England, a cheerleader for health privatisation ended up with more power over our health service than any cabinet minister has. You've got to bear in mind, this is just 2 years after the Lansley health reforms came in, which just ramped up the opportunism for private health interests. Big business as that is. United Health has a turnover of some $324 billion annually, so you can understand the appeal an untapped market would be to a healthcare giant that our NHS represents to such people. Lansley's reforms threw the door wide open and NHS England had a health privatiser in charge of them. Wonderful. That was 2014, like I said. That's 10 years ago now. And our NHS has been systematically, bit by bit, destroyed. And now we can't even have fully trained doctors to treat us, we're being told. Or rather not told. We're being tricked into thinking. The takeover of NHS England by private health interests has seen US healthcare creep in more and more. The NHS itself has been butchered, with the most profitable bits tendered out to private health interests to make profit out of. And when you introduce a profit margin to our healthcare, that's money that would otherwise have gone into the healthcare, that instead now goes to line the pockets of the CEOs and their like, creaming cash off the top for delivering poorer services with bigger backlogs, with fewer staff, particularly trained staff. Our NHS has gone from serving everyone for their every health need free at point of service to becoming a construct where cuts, closures and privatisation have become incentivised instead. There's been hell up, of course. Doctors have kicked off, gone on strike, demanded the privatisation must be reversed. We've seen years of this, haven't we? So, of course, the government needed to do some damage limitation in the intervening years. And if you've heard of the term ICS, or Integrated Care System, mentioned on the news, that is basically their fix. But it's a fix to the narrative. It's a fudge again, not to the health service itself. A harmless bureaucratic fix to the 2012 Health and Social Care Act that Andrew Lansley got wrong. Oh, he made a mistake. We'll just patch it up with this. We'll bring the health and social care bodies together. That'll save money. They'll better liaise with each other. The NHS will have never had it so good, they said. Well, this was a lie as well. ICS are designed to once again make money for cuts, closures and privatisation. Nothing's actually changed. A reward system in effect for the budget holders is all it is. If they manage to spend less money, well, they get to pocket more of it. NHS England is the mask behind which all anti-NHS policies are hidden. Our health service is being destroyed and people are being blinded to the fact by mainstream media selling this ongoing privatisation as if it's a fix. If they even talk about it at all, of course. Scrapping doctors now in favour of PAs and AAs is a symptom of this infection pervading our NHS getting worse. If we're to avoid the decline of our NHS becoming terminal, we need to stop voting people in who won't reverse this, won't restore it to the fully renationalised and redistributed health service brought in by Nye Bevan. The Green Party is committed to repealing the 2022 Act which legalised ICSs, which is far more than any other party is discussing. But that still doesn't go far enough, and I say that as a Green myself. I want to hear them talking more about abolishing the ICS-led policies that are continuing the privatisation. Unless this gets dealt with, waiting lists are going to keep going up. More and more doctors, the real ones, will be driven away or done away with completely in favour of cheaper knockoff versions that we'll be told are just as good. Opportunities for them are already being reduced in favour of cheaper options, renaming them as they go to make them look like doctors, and all of our health will suffer going forwards. If people don't start objecting to this and actually fighting, then we'll end up with the NHS that we all do actually deserve, which is one that doesn't work, is ready to be abolished and replaced with one we mostly won't be able to afford. Forewarned is forearmed, folks. consider yourself warned. And with Wes Streeting already describing the NHS as unsustainable, Labour sure as heck isn't going to fix things where the Tories leave, if it seems likely they return to power at the next general election, as this video here will explain all about. More austerity for the NHS from Labour. You might want to check it out, and I'll hopefully catch you on the next vid. Cheers, folks.